Hello everyone. At present in the world, the most buzzing word almost at all places of the earth is vaccine. Basically, what is the vaccine? A vaccine is a thing that provides active acquired immunity to a particular infectious disease when attacked on the body. Vaccines typically contain dead or inactivated organisms or purified products derived from them to produce antibodies against infectious diseases. There are so many types of vaccines. Let's discuss each one. Number 1. Attenuate. Some vaccines contain live attenuated microorganisms. Many of these are active viruses that have been cultivated under conditions that disable their virulent properties or that use closely related but less dangerous organisms to produce a broad immune response. Number 2. Inactivated. Some vaccines contain inactivated but previously virulent microorganisms that have been destroyed with chemicals, heat or radiation, ghosts with intact but empty bacterial cell envelopes. Number 3. Toxoid. Toxoid vaccines are made from inactivated toxic compounds that cause illness rather than microorganism. Number 4. Subunit. Rather than introducing an inactivated or attenuated microorganism to an immune system, which would constitute a whole agent vaccine, a subunit vaccine uses a fragment of it to create an immune response. Number 5. Conjugate. Certain bacteria have a polysaccharide outer coat that is poorly immunogenic. Number 6. Outer membrane vesicle. Outer membrane vesicles, OMVs, are naturally immunogenic and can be manipulated to produce potent vaccines. Number 7. Heterotypic. Heterologous vaccines are also known as general lab vaccines or vaccines that are pathogens of other animals that either do not cause disease or cause mild disease in the organism being treated. Number 8. Viral vector. Viral vector vaccines use a safe virus to insert pathogen genes in the body to produce specific antigens such as surface proteins to stimulate an immune response. Number 9. RNA. A mRNA vaccine or RNA vaccine is a novel type of vaccine which is composed of nucleic acid RNA packaged within a vector such as lipid nanoparticles. Explanation. In May 2020, the United States government made deals with AstraZeneca that it would fund them to speed up the vaccine research, and in return it promised 300 million doses of vaccines if it is successful. After that, many developed countries such as UK, Canada, Japan, Israel and other EU countries, these types of deals that countries that make directly with companies are called bilateral deals. But there was no guarantee that they could make and pass all the phases of testing. That means if the vaccines fail, that means there would be a loss of investments that can be endured by developed countries but not by low income and middle income countries. So the countries with low income wait up to pass all the phases and invest in them. By that time, they are at the end of the line behind developed countries. High-income countries invested in multiple options and suppliers, often securing enough doses to cover their population several times. For example, Peru made a deal with AstraZeneca but won't see those until at least September. For the above analysis, we can say that rich countries decide when other countries will get what and the main objective of Covax to provide vaccine to 92 middle and low income countries that were shut out from making their deals. It does this using a two-part system. First part is to allow high income countries to buy into and access multiple vaccines at once. Instead of countries giving $2 billion directly to AstraZeneca, they give money to Covax, which would use it to fund several different vaccines. This way, if one or two of them fail early on, it wouldn't be a loss. The other vaccines in the portfolio would make up for it. The system of investing is called multilateral system. That is much lower risk for countries. This would drive down the cost of vaccine and fund vaccine development. Second part is to buy vaccines for lower income countries. It is funded by the wealthier governments and organizations. As vaccines become available, Covax hand them out to every country at once. So all the rich countries and poor countries gets the vaccine at the same time. For this to work out properly, Covax need the support of the developed countries, that is, they should use the multilateral system. But it is formulated a month ago. By this time, all the rich countries made its bilateral deals. So many countries didn't show interest. Without the cooperation of rich countries, it would be underfunded. So it let it this way that the rich countries may keep their bilateral deals and join Covax. That way it would get more vaccines and faster. Though by these rich countries are made most investment in Covax, but still in front line at the manufacturing companies waiting for its doses. Even though rich countries made a promise to donate surplus doses to Covax, but it did not say when. According to experts, Covax will meet its goal by the end of 2021. As of April, they have only purchased only half of them. Vaccines reached a huge number of countries, but nowhere enough to cover the frontline workers in most of the countries. Meanwhile, the US has already administered 200 million doses and quickly opening vaccines to children. This vaccine is bigger than bilateral deals. Inequality is in every step from manufacturing to the distribution. From this, we can say that pandemic preparedness cannot be built